afternoon. Happy Thursday. Thanks for joining us on Midday at 12:30. I am Amber Freeman. We're doing things a little bit different today. We have a very, very important topic, so we're just going to go ahead and jump right in. October marks Breast Cancer Awareness Month, and as we discussed earlier this week with Dr. Emily Marcinkowski, she was surgical oncologist from UK Markey Cancer Center affiliate network. Most women with breast cancer have no risk factors and no medical history of the disease, and some don't even have symptoms. That's why early detection is a key factor in effectively fighting this common cancer. We have with us here today Tamila Humphries and Kim Harbison, lead mammography technicians from Clark Regional Medical Center in Winchester, Kentucky, and Georgetown Community Hospital in Georgetown, respectively. Both Clark and Georgetown are part of the UK Markey Cancer Center affiliate network and sister hospitals that are part of a LifePoint Health. They're here with us today to discuss the importance of having your yearly mammogram. Welcome, both of you, to the show. We appreciate you being here so much.
Thank you for having us.
Well, let's just jump right in. Women over the age of 40 are encouraged to have an annual screening. Now, in order to do this, Kim, do you have to have any kind of note from your doctor or any kind of lead there?
No, you don't have to have an order. You can simply call and schedule the mammogram yourself. They do require that you have an established primary care physician so that we have a doctor to send the results to.
Okay, so just make sure you have that scheduled, and it's easy. So you don't even have to go to your doctor first and get referred to have this. You can take care of it yourself. Now, Tamila, what should women do in order to prepare for a mammogram?
There's not really any certain preparation. No deodorant or powders, but we always have wipes available so that they can wipe off when they get in. A lot of people come from work and things. Other than that, there's really no preparation.
A lot of women have a little bit of anxiety maybe about going in and that entire process. Is there anything you should be wearing to make it easier, or anything that would make a woman more comfortable going into the room?
You just have to undress from the waist up, so you know anything that you're comfortable with works just fine. We'll give you a gown to put on. So
very, very cool. At least that makes it. That's sometimes the biggest part of all of it. Is just that anxiety of going in, which leads right into the next question: should we have any anxiety or be apprehensive about having a mammogram?
No, we try to make the patient feel as comfortable as possible. We explain the procedure thoroughly. We provide warm gowns. We talk through them, through the entire process, just trying to make them feel as comfortable as we can. We answer any questions they have. We try to listen to their concerns, and do what we can. And
help them out. A lot of the anxiety comes from getting those results back. How long should we expect it to take to get the results?
Usually it just takes 1 to 2 days.
Oh, it's quick.
To get your mammogram read. So, and those results go directly to your doctor.
Okay, now a lot of times, more often than women think, we get the results back and we have to go back to have another one. And automatically that fear sets in that, oh no, there's something there. Is that always the case?
No, our radiologists, with today's advanced 3D technology, can see so much more than they could before in the breast tissue. So oftentimes if you get a call to come back, it's just an area of concern. Often it's just benign findings. It could be a simple cyst, lymph nodes, some dense tissue, but it does not automatically mean you have breast cancer.
And I'm glad you mentioned that, because we hear the words dense tissue kind of thrown out there a lot. What exactly does that mean?
It just basically means you have more fibrous tissue, which shows up white on a mammogram, than fatty tissue, which shows up black. Breast cancers also show up white on a mammogram. So if you have more dense tissue, sometimes it makes it a little more difficult or a little more challenging, let's say, to read your mammogram than it does for someone that has a total, fatty breast.
Sure. Now, these machines, they just continue to evolve and are easier and more comfortable for the patients. What has changed over the past few years for maybe somebody who hasn't had one in the past and is a little afraid to go in and get it again because maybe it wasn't the best experience before?
Of course, our latest technology is 3D technology. And as Kim said, that allows us to see a lot more in the breast tissue than we could before. Although compression is still very important, we don't have to use quite as much compression as we did in the past to get the same image, to get a good image, because the 3D technology actually slices through the breast tissue, so we can actually see between the layers without having to use that extreme compression that we used to have.
So it doesn't hurt. That's good
No.
news. That is very, very good news.
Hopefully not.
No, it doesn't. And it's so important to have it done that moment of uncomfortableness is so worth what could have happened had you not done it. Now, how do we schedule our mammograms?
You can call our central scheduling department, and that number is 833-234-4050, and that's for both hospitals, Georgetown and Clark Regional. And we try to get our screening mammogram patients in same day or next day.
Oh, wow. So we don't have to do it even that far in advance.
No.
You make it so easy for us, and you give us so much information. The more prepared we are as women, the better we can take care of ourselves. So we appreciate all that you do at both your facilities and all your affiliates. Thank you so much for coming in here and talking to us about this.
Thank you.
There you go. Stay with us. We'll be right back. I think we are talking Christmas coming up after this. A little bit of a change.